Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Sana. Welcome back to my channel. Today we are going to take a new topic. So in my place, the place where I stay in US, the Ramadan is starting on Wednesday, that is tomorrow. I'm happy to welcome another Ramadan. Alhamdulillah. So today's topic is regarding Ramadan fasting. Okay. Today we are going to discuss about Ramadan fasting and the gynecological health issues. Ramadan can bring some unique considerations for gynecological health, mainly because of fasting, sleep pattern changes, hydration changes, and some menstrual cycle variations. So let's walk through some gynecological issues you may have during this time. First, we are taking the topic fasting and menstrual cycle. In Islam, women are exempt from fasting during their menstruation time. Possible menstrual changes during Ramadan that you may face are some women notice slight delay or early onset of periods, heavy or lighter flow than the usual menstrual flow. Temporary irregular cycles can occur for some people. Increased cramps or fatigue can be seen these times. The reason for change in your usual menstrual cycle or these changes is often happens because of changes in eating time, reduced hydration, sleep disruption, or sleep pattern disturbances. You were sleeping in a constant pattern for the rest of the 11 months, and you are changing your sleeping pattern for a month suddenly. That may also give a change in your biological clock, and you have some body issues due to these changes. And the causes stress or lifestyle changes. You may notice these changes in your cycle or in your menstruation cycle at the time of Ramadan. Usually, the cycle normalizes after the Ramadan period. The when you should seek an attention from a doctor is if irregularity continues for 2 to 3 months after Ramadan, then you should take a medical evaluation. To next topic, vaginal and reproductive health during fasting period. First one in this is hydration and vaginal health. Long lasting hours in US right now, it is 12-hour fasting from Fajr to Maghrib. It is 12 hours this year. In my place it's 12 hours this year. So long fasting hours can reduce fluid intake, which may cause vaginal dryness, increased risk of urinary infections, discomfort during intimacy. I can share some tips to reduce these problems. They are: drink plenty of water between iftar and suhoor. Include water-rich foods like more fruits, soups, yogurt, etc. Avoid excessive caffeine. One point I want to share with you in taking the yogurt is better you take the yogurt and at the suhoor time than taking at the iftar time. Okay, it's more helpful. Okay, so avoid excessive caffeine. So if you are caffeine lover or coffee lover, it can worsen the dehydration of your body while you are fasting. So reduce the caffeine intake as much as possible. Now we come to the next problem, urinary tract infections. Fasting itself does not cause urinary tract infections, but dehydration can increase the risk of UTIs. So watch for burning urination, frequent urge to urinate, low abdominal discomfort, cloudy or strong smelling urine. If these appears, medical consultation is important. Okay. Now let's come to vaginal infections, possible vaginal infections. Changes in diet and dehydration can sometimes lead to yeast infections, bacterial vaginosis, etc. Symptoms of these include abnormal discharge from vagina, itching, unusual odor. If you see these symptoms, you should seek an attention from medical provider. These are common and treatable problems. Now, let's come to the next point, intimacy during Ramadan. Sexual relations are only allowed between iftar and suhoor. They are not allowed during fasting hours. During that time, if sometimes you may feel vaginal dryness due to hydration issues. So the tip for that is intake a lot of water or a lot of fluid between iftar and suhoor time. Okay, so let's come to next point, pregnancy, breastfeeding and Ramadan. Women who are pregnant, breastfeeding, and have a high risk of gynecological conditions are often religiously allowed not to fast if fasting could harm the baby or mother. They are religiously allowed not to fast. Okay. Let's come to the next point, when to see a doctor during Ramadan. Seek care if there is very heavy bleeding, severe pelvic pain, persistent irregular cycles, unusual discharge or itching, recurrent UTIs, severe weakness or dizziness during fasting hours. Okay. So, next, I'm giving you some nutritional tips for hormonal and reproductive balance. Between iftar and suhoor, try to include iron rich foods, dates, spinach, lentils, etc. are iron rich foods, so try to include these in your diet. Include protein rich food like eggs, fish, chicken, and legumes. And also include calcium rich foods like milk, yogurt, nuts. Healthy fats like olive oils and seeds. These support hormonal balance and menstrual health. So that's all about today's video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh. Ramadan Mubarak.